So an overview really of iplanit as it is today with iplanit version 5. In the light blue areas you've got the core iplanit, and included within the core iplanit you have your notes, your plans, document management and workflow. You're able to track and evidence outcomes. You have the alert panel, messages, dashboard. In essence, it's an electronic filing cabinet. You also have your KPIs, whether that be national, local, organisational KPIs that you can link to outcomes, and also the reports. On the outer section, you have the optional modules. Now these are chosen to suit business needs of each provider. So we have the referrals, needs assessments, surveys, calendar, day planner, support tasks, funding and budgets, staff qualifications, and the new event incident management module. Bringing us back to today's webinar theme, demonstrating the impact of an outcome to managers and executives through iplanit. As well as the everyday management of the staff and making sure people are supported in the right way, we believe there are 3 key areas for organisations to focus on when managing outstanding support services. So number 1 is compliance, which enables you to meet CQC and other compliance obligations by using client management systems to create and store accurate and up-to-date client information. Number 2, we have quality assurance, enables you to be transparent, makes everything reportable and accessible. Number 3, we have the quality check-in, which is your plans and your goals and your outcomes, a record of goals including steps to achievement and trackable actions and activities. So when we talk about outcomes in the social care sector, what do we mean and what other terminology is out there? Across the sector, as you're well aware, we hear lots of different words to describe essentially the same thing, which is either goals, aims, talking points, person-centered outcomes, outputs, support outcomes, or provider outcomes. Essentially, all these words describe the things that the person wants to achieve, their dreams, their goals, and their aspirations. We might use the term inputs to describe what we're doing to support the person to achieve these dreams, and we might use the term provider outcomes to describe any organisational goals we have around supporting people. Always at the centre is the person. Outcomes form the foundations of how we support people to live a more meaningful life. So when I talk about provider outcomes, I'm talking about the quality, compliance, strategy, the ability to export data, and most importantly, having a person-centered culture. It's really important for providers to ensure that everything they do encompasses a person-centered approach. What are person-centered approaches? You support a relationship between the carers and the person needing support. You promote the independence of the person receiving support. Communicate effectively with the person receiving support, their families and carers, working together with family members, and most importantly, take the needs and the views of the person you are supporting into account. So how does it work? The power of a single outcome from a manager's point of view is to be able to provide evidence for quality and compliance. It assists with strategic business planning, so you can have a look at your strengths as well as your weaknesses, to be able to identify the areas that need more focus, and you can export all this data into evidence. Most importantly, as a tool, the focus of iplanit is around people's outcomes, and as such it assists and encourages a person-centered culture. So on whatever level you may use iplanit, you can be sure that it supports and backs up your ethos. With iplanit, the flow of information is linked together and attached to an outcome, so all the important items in the person's unified assessment, care plan and service delivery plan are pulled together to bring you the trackable and reportable data. Let's just have a look at why providers choose iplanit. We are about people. We are keen to support people to achieve their hopes, dreams and aspirations. Some ways our system does this is giving your clients a login, creating trackable plans, making it easy to create and set goals, link goals to actions. iplanit also keeps plans alive, makes everything transparent, helps make items trackable and auditable. You're able to link items to the calendar, providing a secure email service, creating a system that puts the person at the centre. So iplanit is for outcomes. We want to assist people to achieve outcomes. iplanit makes it easier. iplanit makes it clear. It helps you keep track of the tasks and activities with ease. You can monitor progress, daily notes, manage complex medical and support needs, track important tasks, report and manage incidents, monitor medication administration, record and track risks, manage individual plans, and numerous daily tasks and activities important to organisations, employees and their clients. For example, through our support task module that separates the person-centred outcomes that we talked about earlier and those essential care type provider outcomes, the balance around important to and important for, which gives you accessible information available on the go, real-time information on support, easy to use system, and it uses templates that are created by you. So iplanit is for managers. iplanit is configured for your team's environment and work. The dashboard is tailored specifically for you. The focus on the person achieving outcomes, and you're able to track your organisational performance supporting people. iplanit offers a variety of ways to view information of the people that we support. You can view information about a person individually, or you can use the various monitoring and reporting tools to view information about people as a group. Viewing information in groups and at a distance can save managerial time. It can often allow you to pick up on inaccuracies or areas of concern that you might otherwise miss.